Good day everyone, I'm Joyce Apodurolfan from BSN 2 12M Group 50. Today I'm going to perform perineal flushing for my return demonstration. Perineal flushing involves cleaning the private areas of the patient, the perineum and the genitalia. This is done to remove perineal secretions and odors, prevention of infection and contamination, and to promote client comfort. Perineal flushing is indicated for patients who are in labor and in postpartum, for patients who has a perineal repair, for comatose patients, bedridden patients, and for those who has an indwelling catheter. Prior to the conduct of the procedure, I have prepared the necessary equipments to be used to conserve time and energy. This includes a bedpan, a kidney basin, 7 pieces of cotton ball soaked in a cleansing solution, 7 pieces of dry cotton balls, sterile forceps, clean gloves, perineal pad, pitcher with warm water, and a new set of clean underwear. I have performed hand washing to protect my patient and myself as well from infection and cross-contamination. Next, I'm going to introduce myself to my patient, verify my patient's identity, and explain the procedure in order to gain her consent and gain her full cooperation. So, good morning, ma'am. I'm Joyce Urolfan, your student nurse today. May I see your wristband, ma'am? Can you please state your complete name and your birthday, please? Alright. Okay, so today, ma'am, we will be doing a perineal flushing. So basically, I'm going to wash your genital area so that you will feel comfortable and refreshed. Would that be alright, ma'am? Alright, so before we begin, I'm just going to close the door to ensure privacy or drape the curtains so that no one from the outside will be able to disturb us while we're doing the perineal flushing. After doing so, place the patient in a dorsal recumbent position. This provides a good visualization of the area to be cleansed. So, ma'am, I need you to flex your knees. I also need to lift your buttocks so that I can place a bedpan underneath. So, I'm going to help you lift your buttocks in a count of 3. 1, 2, 3. After doing that, I am going to wear my clean gloves and then start with cleaning the perineal area of my patient. So, ma'am, I'm going to expose your genital area. The only parts exposed are the areas to be cleansed to help the patient avoid chills from getting embarrassed. So after doing that, I'm going to flush a warm water over my patient's perineal area. I am using warm water because warm water will soften and dissolve blood clots if there are any, and also to prevent the patient from having chills. While I'm doing that, I'm also going to inspect the perineal area of my patient, noting for any particular areas of swelling, inflammation, excessive discharge suppressions from the orifice, and presence of odors. So, ma'am, I am now going to pour warm water over your perineal area. Now I'm going to proceed with the cleaning of the cleaning with the perineum, or cleaning my patient's genitalia. I'm going to place my kidney basin here. This is where I'm going to discard the used cotton balls. So using my sterile forceps, I'm going to pick a cotton ball and then start cleaning the genitalia of my patient, starting from the midline, from the symphysis pubis down to the anus. Remember to never retrace a stroke to prevent contaminating the already cleansed area. Then, we are going to discard it. I'm going to pick another cotton ball to start cleaning from the labia majora, starting from the mons pubis down to the anus, by way of figure 7, then discard it. After doing that, I'm going to clean the groin area of my patient, going up the thigh. Use the other side of the same cotton ball for near groin. Discard, then do the same on the other side. So after doing that, I'm going to flush my patient's genital area with warm water. Okay, ma'am, I'm going to pour again warm water on your genital area. After doing that, I'm going to dry my patient's genital area using dry cotton balls. I'm going to pick up a dry cotton ball and do the same strokes used for cleaning the genitalia. I'm going to begin in the midline from the symphysis pubis down to the anus. I'm going to pick another dry cotton ball and then clean the labia majora by way of figure 7 down to the anus, and then discard the cotton ball. I'm going to do the same on the other side. Then another cotton ball for the other side, or then another cotton ball for the labia majora, then another cotton ball for the other side. After doing that, I'm going to dry the groin area and then discard the cotton ball. After doing that, I'm going to take the bedpan off my patient's buttocks. Ma'am, I'm going to help you lift your buttocks so that I can take the bedpan beneath your buttocks. After doing that, I'm going to turn my patient to her right side so that I can also dry up her buttocks. Ma'am, I need you to turn to your right side so that I can dry side your buttocks. Now we can spray with antiseptic as needed and place a perineal pad and with an up-down motion as needed. Underwear perineal pads absorb blood and discharge changes from the vagina. Next, I will drape the So ma'am, how do you feel? Are you much comfortable and feeling refreshed? That's good to hear, ma'am. Since I'm going to leave you now and I will let you have some rest. If you need anything, do not hesitate to use the call button so that I can go back here and to attend to your need. So, alright. After doing the procedure, I'm going to proceed to do the aftercare of the equipments that I used and then document the procedure that I just did and the discharge that I observed. So that's it for my return demonstration. Thank you for watching. Bye!